Greetings everyone, welcome back to my channel, or welcome if you're new here. So today's video I'm just going to be talking a little bit about the coronavirus situation. I'm speaking purely from my own perspective as a Brit living abroad in Vietnam. I'm just sharing my experiences with the outbreak here, and yeah, that's about it really. I haven't really got a huge amount to say, it's all just personal perspective and opinion. Yeah, I guess it's a little chatty vid for you guys today. As I say, I am jumping right in, talking about my personal experiences with the COVID-19 outbreak here in Vietnam. So far, I feel as though the Vietnamese government have been doing a fantastic job at containing the virus. Initially, there were 16 cases of patients who tested positive for the coronavirus, and they were all treated and recovered. Then patient number 17 came through from Europe and basically hid their identity and their travel movements from the authorities, and thus ended up spreading the virus. So the virus was no longer contained here in Vietnam. And since then, the daily cases have been increasing. There are currently, as of today, I believe 86 cases. We've had no deaths here so far, touch wood. And I really do think it is due to the fantastic containment that the government have been putting in place here. So whilst it may be new for you guys who are based in the US or the UK or other places around Europe where schools and workplaces are closed, here in Vietnam schools have been closed since early mid-February. So basically after Tet, which is their New Year holiday, there was a short period of normality, you know, people going about their daily life, and then mid-Feb, schools closed. So a lot of my friends here are teachers and they haven't been in work for 2 months, over 2 months now, and I'm sure you can imagine that that is creating an impact on not just the expat community that are teachers here, but also on the local people who do live here, because of course if your kids are home from school, well, you know, you have to be there looking after them. You can't just abandon your children and just let them do whatever. That is the current situation. In terms of the outbreaks that have been going on, they have been very well contained. If you live in a big multi-storey building, for example, and one person in the building is tested positive for coronavirus, then the entire building will be on quarantine. They will be locked down for 2 weeks. No one can really go in or out. You are provided food and water by the local government, but that is all. So no one is left without, you know. It's great that the government is taking care of people, and that is the reality for many people here. The other thing I wanted to touch upon is the policies that they are bringing out to contain the virus. So large social gatherings are prohibited. For instance, the Formula One race, I don't even know what the word is here, tournament, whatever, has been cancelled because they don't allow large crowds together. For instance, all bars, well, at least in Ho Chi Minh City, but I'm assuming other parts of the country, are closed. So restaurants are able to operate as normal, but bars are shut, and many businesses of course are suffering, but it must be done in order to contain the virus and contain the spread of it. The other thing that is really innovative is that in Hanoi they have been setting up these disinfection units. So for instance, there is like a unit that is the same size as, say, an ATM vestibule or a telephone box, and you go in, you stand, they spray you down with saline ion solution which disinfects you, and you go about your day. That's it. I think it's really interesting. It's very novel. I have not heard of this kind of stuff, this kind of technology. I don't know the validity of it or anything like that, but I think it is fascinating that there are all these new things being trialled and tested. As of the 16th of March, everyone in public must wear a surgical face mask or a face mask. So for instance, if you are going to the supermarket or the airport or anything like that, I am a little disappointed actually that so many Western governments are advising people not to wear face masks. I think that they are fantastic in reducing the spread of infection. Not only does it mean that someone, yes, who is ill, yes, they are wearing a face mask and it contains all the virus within there. So if they cough or sneeze, then it's contained. So if you are someone who does have an underlying health issue, wearing a mask could actually be very helpful in preventing catching the illness, because the surgical mask has layers. So the outer layer is waterproof, so that any droplets of a sick person who may or may not be talking to you, if it lands on there, well, it's not going to penetrate the mask and it will not go into your system. And yes, of course, it could still go into your eyes, but then, it reduces the chance of that, because your nose and your mouth are covered. So that is like the largest portion of your face. I think the issue with that is that Western governments are finding it difficult to manage the increased need of face masks because people are hoarding them. In my opinion, the real issue here is that Western governments are suggesting that wearing them is not useful or effective. And I disagree with that. I think the true reason that they are saying this is because there is a shortage of these masks for healthcare workers, and of course they are the priority, they need it first. But to then say that it's not necessary is discrediting a lot of ideology behind why wearing a face mask works. And you do just have to look at how many Asian countries have contained the virus. So for instance, South Korea, everyone is encouraged to wear a face mask, ditto in Hong Kong, Taiwan, China of course, and Vietnam. An interesting anecdote actually was the Thai health minister was talking about foreigners and Europeans in Thailand, and he was saying that they are encouraging the spread of the disease because they are refusing to wear these surgical masks. And it's just an interesting take on that, because obviously Westerners are encouraged or told by their governments that it's not necessary, and I personally agree that you should follow the advice of where you're living. So I will follow the Vietnamese government advice based on what they are suggesting that we should do. And the other thing I wanted to touch on as well is the Vietnamese policy and their proactiveness with cancelling and rescheduling flights. So the Vietnamese government have suspended the issuing of visas for all foreign nationals. So if you wanted to get like a visa or a visa on arrival, they're no longer obtainable, and I think that's great because it really does prevent more people entering the country. And currently there are no direct flights to the UK, there are no direct flights going to Australia from here, so Jetstar have confirmed that they are cancelling all flights onwards. It's interesting because the approach of self-preserving the country and making sure that no one comes in or out in that kind of way is very useful in containing the virus. Personally, I think Europe closing their borders was much too delayed. With so many deaths in Europe, you would have thought that the European borders would have been shut earlier, but unfortunately they were not. And I find that very disappointing. So whether you are a foreigner or a Vietnamese national, if you are flying in from abroad, you are automatically quarantined for 14 days. So you are taken to a military base and you are basically staying put for 2 weeks. You will be fed and whatnot, but you will be in quarantine, in isolation. The BBC article I read said that people were being held in an abandoned asylum, and I didn't really think anything of it until I was like scrolling through and I saw that all of the comments left below were talking about how actually this was a bit of fake news. So it turns out people are actually being held at a military base. The army have moved out from their military base to make space for people who are in quarantine. So they're not being held in an abandoned asylum as the news source is making out. It's not as bad conditions as you think it would be. So that's an interesting one. Bit rambly, I'm sorry, is the treatment of foreigners here in Vietnam. So I have come across a couple of businesses where they say they won't serve Europeans or Westerners because they are the spreaders of the virus. So local people are wanting to not conduct business with them. So for instance, this hairdresser here, they are saying that if you are a foreigner, they're not cutting your hair, which is interesting. I don't really know. I'm a bit concerned that it may be a hostile environment towards foreigners, but in the meantime I've experienced nothing of that sort, so I don't know. People here are not buying into mass hysteria and hoarding like they are in the West. So people here are not going to a supermarket and stockpiling on all the frozen food and toilet paper and cleaning products and hand sanitizer, nothing like that. So it's very easy to pop into the shop and get what you need, and there will always be some left for others. I think it is fantastic that there is all the stock available. People are seemingly more mindful about what they need and leaving some for others. When I went to the supermarket to purchase a couple of things that I needed, I didn't see any emptiness on the shelves. Everything was just as normal, to be honest. It was as full as usual. All the stocks were full. There was no mass hysteria in the supermarket. People's trolleys were not filled with a million loo rolls. Everyone was wearing a face mask in the supermarket because, as I say, it's been mandatory for the last couple of days, but prior to that most people were wearing their face masks anyway. My tea's gone cold. Well, yeah, I guess that kind of wraps up my final thoughts and feelings on what it's like being here with COVID-19 causing all these issues for us. So yeah, just stay safe everyone. Hope you're using this opportunity to just reconnect with yourself, and if you do live with your loved ones, with them too. And that's it, I guess. I mean, hope you're not too bored, and see you on the other side.